Last year on Women's Day, the conversation was all about how men can support women. The message was very clear. Support is not just a word, it should also reflect in your partner's action. So, ladies, this one is for you. Some of our biggest firsts don't come with a guidebook. Let's be real. Every first is special, right? What about first acne, first period, or first mental breakdown? Yes, this year we are going to touch upon the depth of these topics, and we have some amazing doctors and experts who are going to break the myths and enlighten us on these topics. So let's begin. So, hi, doctor.
Hi.
Welcome back again. And this year for Women's Day, I have that one big thing for you. Can you guess?
No.
It is that one big pimple on your face. That one big pimple can be अपने हार्मोन्स खराब हो गए और अदरवाइज आपका लाइफ चला गया है or anything which is just taking away your breath. Have you ever observed that in your practice from your patients?
Yes, of course. I have seen patients, I've seen brides getting, I have observed such good skincare throughout my pre bridal time. And then suddenly, just before my event, a pimple has popped, it's going to ruin everything. I have seen people having pimples just before an important presentation, an important function. I have seen teenagers go into self doubt, self esteem issues because of a pimple. So don't take it lightly.
Yes. And just now, as you mentioned about teenagers, so going back to that big pimple, which is like the first pimple.
Yeah.
So I want to ask like that about the first pimple that people get and the anxiety, nervousness और जो भी दिमाग में चलता है, तो how do you deal with it?
Okay. So now let me tell you a full story of somebody who actually visited my clinic with their first pimple. Okay.
Okay.
Now let's name her Kavya. Okay. Now Kavya was all of 12 years when she first visited my clinic. She came with an overbearing mother. And the mother started कि फेस वॉश नहीं करती, सिर्फ पानी से वॉश करती है, ऑयली खाना खाती है, कुछ क्लीन अप नहीं करती, स्क्रबिंग नहीं करती, स्टीम लगाती हूँ नहीं लेती.
Sorry to cut you. At what age?
She came at the age of 12.
Acha.
12 was the age at what she came. And the mom started ranting away. And then all this while, Kavya is keen to seek expert guidance, but she's also very hesitant.
Okay.
She has a lot of, the mom is ranting, I'm in a foreign place, and here I'm supposed to talk about my issues. So I asked Kavya, what do you feel? What do you think? What are your problems? And then Kavya said that, suddenly my skin has become oily. Suddenly my texture has become rough. I have my friends talking about, do you have combination skin? Do you have normal skin? Do you have dry? And she's like, I don't know. People are talking about T-zones, and she's like, I don't even know what's a T-zone. So there's a lot of embarrassment that she doesn't know the lingo when it comes to acne. She says, Doc, you're saying acne so many times, but we all pimples. So what is the difference? What's a blackhead? What's a whitehead? What's an open comedon? What's a closed comedon? I am pursuing a sport. How do I have the time to actually go and wash my face? Because most of my sweat and grime happens in the first half of the day, where I have no access to a face wash. I can't carry a face wash in my bag to school. And she had all these questions. And plus, I have a mother who just keeps telling me that your dirt is clogging your pore and that is what is giving you acne. But then why do I only get the acne? Why don't my friends get? So this was the whole scenario when I had my first patient, a patient who had her first pimple and come to me for this consultation.
Okay. And then, like, what was your response to her?
See, first, acknowledge
Okay.
that yes, there is a problem. Because I've seen, like I mentioned you example of this overbearing mother. I've also had reluctant grandmothers come or aunts coming. उसमें क्या है, हमें भी आए हैं पिंपल्स, हीट की वजह से आते हैं, बॉडी में गर्मी ज्यादा हो गई है. द स्टोरीज वी हैव इन इंडिया, गर्मी ज्यादा हो गई है उसकी वजह से आते हैं.
या फिर मसाला मत खाओ.
Yeah, you eat a mango, you get it. And mean, the myths are many, but then also somebody who is like dismissing your problem. So the first thing is acknowledge that yes, there is a problem. Yes, there is a lot of misinformation amongst your peers, amongst the social media, and there is nobody who's giving them the right information. And TMI, too much information. Then yes, you have problems. Like if you are at school from say 7 to 1 o'clock or 7 to 3 sometimes, and you can't carry a face wash in your bag, or you can't apply your acne cream, then you have to figure out something along with it. Then what are the things? Do you have to do the steam, scrub, facial, multani mitti routine? Like first was acknowledging that yes, there's a problem. Yes, there are problems in addressing the problem also, the limitations, and then telling them this is what you can do. This is what will happen in the future if you do this. This is what will happen if you don't do it.
Okay.
So that calmed down the child a lot. Okay. And then of course there was the actual treatment. So acne, first pimple, there's a lot of hand holding and busting myths, and the acne treatment is very minimal. Very honestly, it's actually very minimal.
Okay. So now the concept of acne और जो pimples बोलते हैं, तो ये होते क्यों है?
So see, to put it very simply, we have oil glands beneath our skin, okay, and they secrete oil. Actually, they don't secrete oil; they secrete something called as sebum, and they are sebaceous glands.
Okay.
Sebum is like a toothpaste-like material. So just before you are actually into that, you're reaching puberty, or you're in that pre-adolescent stage, the production of the oil gland, the sebaceous gland, goes onto the skin and moves out.
Okay.
In some cases, under the effect of all the hormonal changes that happen inside our body, the production exceeds the drainage. So what happens is now you have a clogged sebaceous gland. Once it starts getting clogged, there's bacterial growth inside it. There's a bacterium inside the sebaceous gland called QT bacterium. Okay. Not cute at all, but it's called QT bacterium. And it starts growing. Once it starts growing, the swelling increases a little further. Okay, so when it was the blockage stage, it is called as the comedone. When the production increases, the bacteria grows, it's called a papule. It becomes large, it becomes a papule. Then you have the body's inflammatory cells, the police force, which come and start attacking the bacteria, which is when you start developing those large nodules. And then when everything, all the disaster happens, then you get scarring. So you have a comedone, you have a papule, you can have a pustule, nodule, abscesses, and finally scarring as like the khandar that stays after an acne resolves.
Okay. It was not
It's
easy.
almost like a Bollywood drama, yes, that
Action
happens.
drama.
Action drama, yeah, that happens.
Yeah. And अभी जब बात करें acne का, right? And the puberty that we were talking, majorly it happens during the puberty, or it start after, like, क्या बोलते हैं, adolescence and puberty,
Yes,
right?
yes.
In those cases, lot of us, I mean, what we think it's just because it's a phase कि ये टाइम में तो होता ही है. एंड देयर आर आई थिंक टू कैटेगरीज. एक तो है जो उसके ऊपर ट्रीटमेंट लेते हैं, एंड द सेकंड कैटेगरीज इज इट्स ओके, मैंने इट्स अ फेज, वो जाएगा. बट आई हैव आल्सो सीन माय फ्रेंड्स एट ड्यूरिंग माय टीनेज टाइम कि उन्होंने ऐसे ही छोड़ा एंड देन दे हैड दिस, बोले ना, पूरे फेस पे इतने बड़े बड़े स्कार्स.
Right.
So like what is an ideal way to deal with acne at that point?
See, firstly, acne happens to everyone. The severity differs.
Okay.
Some people might just get some blackheads and whiteheads that can be managed with just a face wash. Some people get nodular acne जहाँ पे आपको medicines लेना पड़ता है for say 6 months, 9 months.
Okay.
You know, and even then there's a chance it could leave scars. So the treatments vary for both kinds of people. So the first thing is you should have the right kind of information. Who will give you the right kind of information? A dermatologist, right? And with due respect to everyone else, please do not seek information from unqualified professional, because we see so many cases where they've done DIY things, they've done cleanups and parlors and whatever, and worsened their existing acne. Mane, if you wouldn't have treated your acne in the first place,
automatically
it would have still been okay. It would have been a little less damage, but because you intervened and did all the wrong things, the acne worsened. So go to a dermatologist, identify, like I said, there are stages. So the treatment varies as per stages. Okay. And your dermatologist is there. Let your dermatologist be your skincare partner.
Okay.
in your journey
Sure.
for acne rather than it being anyone else.
Okay. And बहुत weird है, but I'll just still share. कुछ लोगों को acne फोड़ने में मजा आता है.
It's
Right?
the most satisfying thing in the world.
Yeah, I mean, I have done that in my
Yeah.
past. So, any comments on that?
So see, obviously it should not be done. Popping your acne, forget about popping your acne. I've seen my nieces, you're watching a TV and then they have this one pimple and they'll be like just fiddling with it, literally playing with it, like as if it's some funny blob on your skin. So every time you touch your acne, two things happen. One is you're irritating it. तो अंदर जो युद्ध चल रहा है between the Cutibacterium and the inflammatory cells, you are actually triggering it more.
Okay.
What I just mentioned, like there's an inflammatory cells coming and attacking the bacteria. So you're triggering it more. Also, what you're potentially doing is you have bacteria beneath your fingers. Your fingernails are a storehouse of bacteria. So if you have a grown nail, you can actually pass on that infection and injure your acne. Also, there is a sebaceous gland right next to the inflamed sebaceous gland who is calm, who is not inflamed. But you are triggering it and activating the acne. So you see a lot of people who see acne 1, 2, 3 close to each other, then 1, 2, 3 close here. These are the people who fiddled with it.
Okay.
Also, when you fiddle with an acne, there is a very high chance it will leave a mark or a scar. Okay. As opposed to you not fiddling with it. So fiddling only gives you mental satisfaction, but it almost always worsens the acne.
Sometime back you were mentioning about some, multani mitti and all those stuff and some myths. तो exactly क्या type के myths होते हैं लोगों में?
Oh my God, myths तो बहुत सारे होते हैं. Starting from पेट साफ होगा तो acne नहीं आएगा.
Okay.
खून साफ होगा तो acne नहीं आएगा. So I've seen people passing on their potions generations में कि ये खून साफ करने वाला जड़ी बूटी का दवा है. ये अब पेट साफ तुम्हारा नहीं होता, you are bloated which is why you are getting acne. और ऑयली फूड्स खाने से एक्ने आता है. इट्स लिटरली लाइक आपने यहाँ से पूरी खाई और वो यहाँ स्किन से बाहर निकल गई.
कल तुमने खाया था ना, देखो अभी मुंह पे आ गया.
या एंड हीट, बॉडी हीट इज गिविंग यू एक्ने, सो ऑल्सो क्लीन अप करना बहुत जरूरी है. दैट यू हैव टू हैव क्लीन अप्स ग्रोइंग अप. क्लीन अप इज द मोस्ट फ्यूटाइल एक्टिविटी पीपल डू ऑन देयर स्किन. Just logically, think about it. There is an acne which is like over here. I have a circular instrument. I'm pressing it on all the sides with that circular instrument. How do I guarantee कि वो और अंदर नहीं जाएगा लेकिन बाहर ही आएगा? How do you guarantee? If you're pressing something from the top, even if you're doing it at the edges, there's a chance you can push it inside.
No,
and
I
make
think
it
that
even
happens
worse.
at times. Sometimes we expect acne to get burst, but when होता नहीं वो.
Yes, there's a way. If it is not done by an expert person, by a trained person, there's a good chance you're pushing it further inside and making it worse. How many people we see who said कि we've done a facial and we've got more acne, we've done a cleanup and we've got more acne? There are so many people. People talk about scrubbing their face. It's not wood. That randa marna zaruri hota hai. You don't have to. Scrubbing is not, especially the ones with those particles. You know how many times these small particles.
Almond particles and all those scrubs, right?
Yeah, you've got so many of them. Apricot scrubs and, fine particles. One is they are not environment friendly also, like they're affecting our marine flora as well. But apart from that, there's a chance they also clog your pores further. They are so tiny, they can actually go and physically clog your pores. Multani mitti. Oh my God, do you know Multan is a place in Pakistan? You think actually people are going to Pakistan and getting the mitti from there? Or do you think the geographical location of that place in today's times with the amount of pollution and adulteration that mitti will have any kind of... It only dries up your skin.
Yes.
For people who have oily skin, it dries up your skin. But can you say कि इतना ही dry करो? Acne can happen in people who have oily skin and people who have dry skin. Right? Because oiliness is just an aftermath. It's not the reason for causing acne.
Okay.
So, all of this, I absolutely tell people that you're putting your money in the wrong place. ये सब इनमें से किसी भी चीज से acne नहीं होता.
Wow. तो किस चीज से होता है?
Yeah, very good question. So, dietary wise, with a lot of scientific backed research to it, milk and milk products, except yogurt, that is dahi. is known to cause acne, and these are scientifically proven things.
Okay.
So when you're talking about milk and milk products, usme aata hai your chocolates, cheese, the pastas, the cheese pizzas and the burgers that you eat, even the pastries that you have. All of these are loaded with milk and milk products.
Right.
So these are known to cause acne because milk causes release of something called as insulin-like growth factor,
Okay.
which triggers the inflammatory process. And growing up years, हम तो रोज दूध पीते हैं.
Yeah.
So
India में
telling-
तो बहुत common है.
Yes, and telling a parent that stop the milk, you get a crazy response. But milk and milk products are definitely implicated in worsening your acne.
Okay. And apart from milk products?
That's it. Milk products are the major thing. Also, see, if you have something which has a lot of maida in it,
Achha.
anything which comes from maida, whether it is a bread, whether it is khari, the biscuits that we eat, now these are loaded with sugars. So sugary foods which are not sweet in nature. Like if I eat a gulab jamun, I'll eat one, I'll eat two, I'll be like, oh, it's too sweet. But if I'm eating a khari,
Got it.
so items which are rich in refined sugars, like anything that is coming from maida, you think of maida and you'll know what all things you have.
Understood.
So all these things which have a lot of sugar in it, refined sugars in it, are also known to trigger your acne.
Okay. I mean, I was not knowing कि हम क्या दूध और शक्कर कम करने से
chai biscuit is our
daily,
culture, it's our
yeah.
heritage, but not doing good to your skin.
Thanks for enlightening us.
Yes.
And one more thing about generations that you were talking about. So acne pass hota hai generation to generations?
So very good question, because a lot of times people believe कि अरे मेरे पापा को acne था तो मुझे भी होगा. So acne happens because of the hormonal changes in your body.
Okay.
It
Nothing
will
to
not
do
happen.
with-
Yeah. So every child, irrespective of whether what family they belong to, they are going to get acne. Everybody gets acne from the age of 13 to 25,
Okay.
or probably even earlier. The severity of acne is what runs in families. Like if your father has had scarring acne or your mother has had scarring acne, there's a good chance you will have scarring acne. So when you get acne, you start getting acne, if you seek treatment properly and you give this history that my parent also had bad scarring acne, you can totally avoid that sequelae.
Okay.
So that generation knowledge comes to your advantage actually. So severity can be transmitted, not the acne.
So and adding on to that about the habits and everything. So generation right now we have Gen Z or maybe उसके भी अभी advancements है. तो their habits, मतलब food habits, sleeping habit, any type of habit is, I think I define it as extremes or not controlled. Not for everyone, but yeah, in like majority if we count it is like extremes. So
Yes.
does it also affect acne?
So stress, sleep deprivation majorly affect acne. So how many times you've seen somebody just before their exams, their periods get delayed.
Mm-hmm.
And the delay of periods can in turn cause a hormonal havoc and worsen your acne. So people who are doing night shifts,
Okay.
I've seen so many people develop acne, or people who are burning the midnight oil and staying, because you're going against nature. People who are not sleeping, getting at least 7 hours of sleep, for them also, because once you're on the Instagram in the night, you're watching one reel and you realize you're watching reels for 2 hours.
Yes.
Without any benefit of it.
Right.
We've all done that. So,
Right.
why blame someone who's so much more younger than us? But yeah, sleep deprivation and stress are definitely known to worsen acne. Smoking is known to worsen acne.
Okay.
Now, maybe 20 years back when I was a teenager, or maybe more, smoking was not so much common in a teenager,
Mhm.
but now it is.
Now it is.
So even that could be a worsening factors. If somebody is going to a gym and very hardcore about developing a certain kind of body, and you're taking some supplements, unknowingly consuming some form of growth hormone, even that can make your acne worse.
Okay.
There's so many nutritional supplements, not nutritional supplements, muscle enhancing supplements, which can also give you acne, which I see a lot of youngsters, teenagers, people who got their first acne, we can also attribute it to these supplements.
Okay. Nice. And have you encountered any severe, incidences happening around this particular age group?
So the funny thing which is DIY, which I
Yes.
encounter, okay, like going to your kitchen and instead of putting it inside your stomach, you put it on your face. I have seen people applying lasun on their face
Wow.
कि वो स्कार नहीं करेगा, and then they come to a dermat कि जो लहसुन का स्कार बना है उसका ट्रीटमेंट करते हैं.
अरे.
So that is very common. I've seen people applying chia seeds to their face for moisturization purpose, dahi, honey, haldi, so many things. See, if you have good skin, see, I have nothing against DIYs, okay? I don't like them, but I have nothing against them. If you have good skin, the maximum benefit a DIY can do for you, any DIY, whether it is tomato or any of these things that are there, is they can hydrate.
Okay.
Like when you use curd on the skin, it's hydrating. When you use, say, a haldi on the skin, it's probably a little brightening. But you have an actual problem like acne or pigmentation or whatever, eczemas or melasma, you have a problem. And you are using a DIY, plus you are also using a medicated cream. These two things can mix and create havoc.
Okay.
So DIYs is what I see commonly. Funny, garlic. People apply toothpaste on their acne, because somehow toothpaste are supposed to make the acne small or whatever. Whatever is the concept behind it. So yeah, generally these are the breaking your acne on your own, DIYs karna. You have a lot of these times, you have these fancy instruments that are being sold.
Okay.
Like, those pore cleansing instruments or a blue light therapy and all. See, if you have the money, buy it, but don't expect it to create wonders.
Right.
You can't use a face wash and expect your acne to go away. A face wash is supposed to cleanse your skin.
Yeah, just now you mentioned about face washes, right?
Right.
तो मार्केट में जो है ना कि स्पेसिफिकली डिजाइंड फॉर एक्ने ट्रीटमेंट,
Yes.
तो उसमें अलग क्या होता है?
So right now ना बहुत सारे कोविड के दौरान there have been so many over the counter products which have come which are containing the actives. Salicylic acid है, benzyl peroxide है, retinol है. There are so many of them that are there. See, again what you have to understand is there are stages of acne. There are some stages जैसे comedonal stages है. उस पे using a salicylic acid serum or a salicylic acid face wash would be enough.
Okay.
बट देन अगर आप कॉमेडॉन, पैप्यूल, नोड्यूल, कॉमेडॉन से आगे अगर आप इन स्टेजेस पे जाओगे, देन दीज थिंग्स विल ओनली मेक योर स्किन ड्राई without addressing the inflammation, because none of them are equipped to deal with inflammation.
Okay.
In that situation, you have to meet a dermatologist and take the necessary medical treatment. तब ये OTC नहीं काम आएगा. Nothing against the OTCs, but if you're in a comedonal stage, probably it will work.
Okay. And today about women, like what we feel ki accept the type of skin color that you have or texture that you have, just be there kind of thing, and they celebrate your skin, then why these beauty products are getting consumed so much?
Very good question. And this is a question I would also like to ask the viewers of this podcast, that on one hand, we are having double standards.
Yeah.
On one hand, we talk about accepting our skin. And very honestly, I'm not judging anyone, but I have not seen anyone saying, I love my acne scars. I have not seen anyone saying that, because this is something which can be very easily manageable. It's not a difficult, it's just that doing too many things have made it worse. So it's great to accept your skin the way it is. But if you do not like it, do not hesitate to seek a professional help, is what I'm trying to say. Instead of getting, all lost in the world of misinformation.
Yeah. And now I'll just put across some examples of, or maybe situations that I have heard from people at age of like maybe 18 to 20, 22. There are breakups happening because of acne.
Yes.
Have you ever heard about it?
Maybe not directly, but yeah, I've heard of people losing jobs.
Yes.
Because of acne. I have heard of people being dropped out from performances. Like, you have these college fests because of acne, out of plays. People, again, relationships are not my forte, but I'm sure if you're telling me that, then
I mean,
yes,
there are people
yes,
I've heard people saying कि नहीं, now she's not looking as beautiful as she was.
yeah,
So
yes, yes.
I mean, they're choosing the
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 physical
physical
appearance
appearance.
over their.
And I think school में ही तो अभी सिखाया जा रहा है ना, like equality and then no racism and all those stuff.
Correct, correct.
So doctor, the way you're saying इतने सारे problems है just because of acne. So any say that you have on this?
See, I think the one that is bothering the teenagers the most is what their peers are saying about it, you know. See, what you have to understand is everybody is going to get acne. Supposing I am the guy who's breaking up with a girl or ditching a girl because she's got acne, remember that you also have hormonal changes. Tomorrow you could also get really bad acne. There are people who get acne on the body as well, you know,
Yes,
which
yes.
actually people, especially who are like sweating a lot, who get dandruff, we call it truncal acne. So you could also get it. Your sister could also get it. Somebody in your family member. So while you are ditching someone here right now, your sister could also get ditched at the same time. So accepting your acne, providing emotional support to your fellow peer or girlfriend or friends is of paramount importance, because you are all sailing in the same boat. You just could be at different stages of acne.
Yep.
So that emotional support that we always speak about,
But we never
on
give. We
but
are
we
still
don't.
judgmental.
Yeah, we continue to be judgmental and very opinionated on it. I think we can also actually for once give that emotional support to our peers.
I mean, think about it. If we're just talking about one acne, it's not even about the entire appearance, how your skin and body is looking,
Exactly.
how big it can make a difference. Thanks, Doc, for sharing a lot of insights with us and bursting all the myths. And I'm sure we will not burst our acne anymore. Yeah.
Hopefully.
Yeah. And with this, I want to understand like the generation or maybe people who are going through this phase of their first acne. What kind of message that you want to give it to them?
Okay. So, firstly, that understand that having acne is a normal phenomenon. It's a physiological phenomenon. Okay. So, pehla, having acne is not like plague. It's
Okay.
not. You know, it doesn't spread from one person to another. You're not going to scar for life. Okay. So, one is accepting that having acne is normal, providing support to your peers who are having acne. Second is do not take any kind of information from social media or your friend कि मैं ये treatment कर रही हूँ तो तू भी ले ले, or from your chemist कि ये
Yes.
cream लगा लो for acne, or from your beauty parlor दीदी. With due respect, grooming के लिए best है but medical treatment के लिए नहीं. So looking away from all the misinformation is very important as much as taking the right information from an expert. So visiting a dermatologist, use it to your advantage that if your family mein anybody has had severe acne, take treatment on time. You can completely avoid scarring.
Okay.
That is also super important.
And since we are talking about Women's Day, right? So, like a teenager and her mother, what do you think? What kind of phase that will be, and how their mothers can support their child?
Oh my God, this is a very tough question because, again, not my forte. But I think as parents, equip yourself with knowledge. Like when I told you the story about Kavya, the mother kept on saying ये face wash ही नहीं करती, ये scrub ही नहीं करती, ये oily food खाती है. Understand that इनमें से किसी से भी acne नहीं हुआ है. So equip yourself with information. I know the teenagers don't listen, but you're repeating your ranting is not making them listen. It's actually distancing them more. Okay, and helping them in their journey rather than pinpointing things.
Right.
अरे ये acne कैसे आ गया? अरे अब क्या करेंगे? और also telling your relatives also that you know पहले कितना अच्छा साफ चेहरा था, अब क्या हो गया? So telling them that do not pass a comment on it. These are the steps that a parent can take, because at the end of it, they are looking for a loving, supportive environment at home. Problems are going to come, but let us not be the ones picking those problems and pointing them out and taking that microscope to look at them. And treatment takes time.
Yes.
So reinforcing the child that yes, if you have acne, it's going to take 6 weeks for it to settle. We can't do it overnight, which is why the popping of the pimple happens, because they feel that will settle it overnight. So being supportive with the child, it's going to take time, but it is going to happen. Support is, I think, all mothers and fathers also, for that
Yes.
matter, need to give to their teenage children.
I mean, thank you so much. I mean, it was really, really fun because I personally never expected कि एक acne के ऊपर हम लोग इतना बात कर पाएंगे. So thank you so much, Doc.
Yes, my pleasure.
Happy Women's Day.
You too. Thank you so much.
Thanks. Hi, welcome back, Dr. Tushna.
Thank you, Tushar.
How are you feeling?
Superb.
Yeah. So last year we discussed how men can help, right?
Correct.
Yeah. This year I have something different for you.
Okay.
So the topic for this year on Women's Day I've selected is the red alert,
Okay.
the first period. I mean, and the problems and everything that follows.
Correct.
So I have few questions for you.
Shoot.
So first of all, since we are talking about first period,
Huh.
when it happens.
Right. So when does it happen? So obviously when we say that a girl is getting her first period, we are expecting that girl to be a school going girl. Right? So the average age is anywhere between 10 to 14, with an average of, say, maybe you can hold a 12.
Okay.
But in today's day and age, we are seeing girls as young as 7 and 8
Yes, that's true.
getting their cycles, right? And saying that there are girls who are getting their cycles even at the age of 15 and 16.
Okay.
So till 16, we scientifically say it's normal, but there are a lot of things associated with it. Okay, so let's take the 16 part first. That if a girl doesn't get her cycle till the age of, say, 15 or 16, but she has other characteristics, right? She has pubic hair, she has underarm hair, she has a growth spurt, she has breast growing, you can kind of wait, obviously meet a doctor, but kind of wait, but she will ultimately get her cycle, right? But a young girl as young as 7 or 8 getting a cycle, we are not prepared for it.
That's
right?
true, and that's my question. अभी जो situation है
हाँ.
वहाँ पे we are seeing like fourth standard, third standard girls, they are also getting their
True.
period, chums, whatever
Yeah.
we call it.
Right.
And parents are not ready.
They are not.
And of course, children are not ready. And we are
True.
seeing or reading through such instances. So, what is your take on that?
So my take on that is, one, parents have to accept that today's average age of a girl getting her cycle could be 7, 8.
Okay.
Is it completely normal? Not really.
Mhm.
Okay. It depends from girl to girl, situation to situation. But a mother and a father need to be prepared that this could happen, and obviously prepare their children. Now, why am I saying children? And why am I not only saying prepare their girls? Because the boys also have to be made aware of this situation, so that their empathy towards their friends and colleagues is more prominent, and it's more prompt, and they can help out, and that girl doesn't feel alone.
Alone.
Right?
left out.
So if a 8-year-old knows कि period kya hai, what is, give it any name, give it a period, give it a chum, give it a menstrual cycle, whatever you call it. But if she knows what it is, even if she does get it when she's in a school environment, or when
Yes,
she's in
yes.
an environment where she's surrounded by friends and maybe no adults, she knows how to deal with the situation. At the same time, when she has friends around her, and if they are also aware, they know how to help her in that situation. So it just works out, right?
Yes.
So you have to be prepared.
Yeah, and I think I am really happy with the Whisper campaign that is, they've launched recently.
Absolutely.
I mean, it was high time. It's not like just pad देना किसी husband को wife को बताना है, but it is
Correct.
about the
Awareness.
young age and the parents. I mean, I have seen parents particularly कि नहीं मेरे बच्चे को ये टाइम पे periods नहीं आने चाहिए. एंड अगर आए तो दे गेट सो पैनिक कि नहीं ऐसा हम लोगों ने क्या कर दिया कि इसको इतना जल्दी पीरियड्स आ गए.
True.
सो आई वांट टू आस्क लाइक व्हाट आर द कॉमन रीजंस टू गेट पीरियड्स अर्ली और मे बी डिलेड.
So medically there are a lot of reasons, right, why
Mhm.
a girl can get her period very early or very late. Even though 16 is not considered very late, it's still in the normal range.
Okay.
But the average is 12, 13 when a girl gets her cycle. Now, in today's day and age, we see it come earlier, like the average has kind of come down to 10 for a lot of reasons. Environmental reasons being the most common.
Okay.
Depending on the food we eat, the toxins we are exposed to in daily life, which was not present in as much quantity so many years back. So that does change things. Um, Saying all this, when we see a very young girl get her cycle, and if the associated factors do not match, we are working together with endocrinologists and everything, where we do try and delay that particular cycle, and we do try and prevent certain hormones from being released to help that girl on the other aspects.
Okay.
But that doesn't happen for every girl. Every 8-year-old girl who gets her period is not wrong, right? But you cannot take that for granted. You have to involve a medical professional to actually understand where you and your daughter stand.
And I have seen a lot of parents visiting a psychologist also
Yeah.
to seek help and understand how to deal their children.
Correct.
So
The thing over here is, coming back to the crux, that parents need to be well informed. Parents need to be well educated. Parents need to be open to have that discussion with their daughter and son.
yes.
So, a personal example, I have a son. And does my son know what periods is? Yes. Okay.
How old he is?
He will turn 9, but he
Okay.
knows it from the age of 7, 7.5. Because my logic at that point of time was that if I do meet these girls in my consulting rooms, then my 7-year-old boy also needs to understand what periods are.
Yes.
And that is how you take things forward. That is how this generation or PD goes ahead,
Right.
and understands the importance of talking, being vocal, and discussing. So if she's aware, if he's aware, they're less scared. Otherwise, imagine a young girl suddenly going to the bathroom and seeing blood. If you don't know, like I can have,
Right.
yeah, like rongte khade hona, because if you don't know what it is, you're going to freak out. You're going to panic ki, where is this blood coming from? And it just comes out of nowhere. So I'll tell you this one story of this one patient of mine. Okay, she's a young girl. Her mother has actually been my patient for a very long period of time. I have delivered this young girl. Okay. And one day, I just meet this patient, comes to me in my OPD, and she bursts out crying, and I'm wondering why. And she's like, you know what, this happened to my daughter. So I'm like, what happened to her? She's like, oh, she was in school and she saw blood in her panties. She thought that something must have hurt her or something must have happened. She did not inform anybody. After 2 days at home, I realized that, oh, I'm seeing stains in her panty, like washed stains, but stains. So I talked to her about it. And then I realized that she's got her period.
Oh.
This girl is a 5th grader. So she's what, 10? Ke aaspaas. So I'm like, you had not spoken to her about what periods are before? She's like, nahi yaar, I had not spoken to her. I'm like, see, that is where we went wrong. Fortunately, this girl, when she started her periods, only started spotting.
Oh.
Okay. But what if she got a complete flow? If she had a complete flow, she would stain her clothes, she would stain her undies, she would stain everything, right? And it would have become a bigger thing for her, with people asking, talking, discussing things about her. Fortunately, that did not happen. But that is when I told her, I'm like, see, talking about it. And she has a younger son,
Okay.
also delivered by me. So I said, this is where you need to learn, that you need to keep them pre-informed. Today in the market, we have a lot of books in comic format, which help these young girls understand what periods are, why we get it, why we are so fortunate as girls to have something called periods, why boys don't get it. Because as they grow, and if they do have problems with their cycles, their first complaint is, why us? Why are the boys not going through it?
Right.
So they need to understand, why us? Why are the boys not going through
Right.
it, right? So that is a thing. But yeah, this one girl always comes to my mind, especially because I've delivered her and all my babies are very close to me. So if she was pre-informed, and again, why was this lady crying? I'm like, why are you crying? She's like, oh, because she went through it. I'm like, it's okay. It's not trauma, you know, but deal with it. But we need to be okay with it. She's like, अरे मुझे तो 10th standard में आया था. I'm like, it's okay. And then when I told her that I'm seeing girls younger than her daughter, that is when she had a little, sense of calmness.
Yes.
That, okay, it's fine.
Yeah, and Doc, I think majority of them are in their schools, right?
True.
तो ये टाइम पे earlier, like when we were kids, ideally 8-9 standard तक हमको ये बताया जाता था कि वो
What are periods?
right.
हाँ.
So now what is an ideal age that you think that schools should also take initiative to educate them?
I feel as early as the 8-9-year-olds should be informed and taught in a fun way.
Right.
Don't make it a topic. Don't make it a study thing कि ये करना है. Most of our schools now have these things on safe touch, unsafe touch.
Yes.
Right? You have these workshops. So have workshops about what periods are, and not for the girls, for the class. Make it a normal thing. Normalize periods, and the best way to normalize periods is to start talking about it to both the genders, and from a young age. That is how you're going to help normalize something as normal as periods. Yeah.
And another question is about the cycle. What is a normal cycle?
The duration and all.
Yeah, duration.
So a routine cycle, like on an average, we say can last anywhere from 21, 22 to around 35 days. Okay. That is, you get it as regularly as 21, 22 to 35 days. Okay. And the bleeding can last anywhere between say 5 to 7 days. But this is the average. Okay. Right? There will be some girls, and especially when they have just got their periods, which is called menarche in our medical term. Okay. When they've just got their periods, there are 20 to 30% of them who will not get regular cycles, who will get cycles once in 2-3 months, once in 5 months, once in 6 months. Okay. That is also normal. Okay. But at that point of time, you have to involve your gynec to know how normal it is.
So how often they should be involving? Because the range is different.
I always feel that the minute a young girl gets her cycle, she should have a gynec.
Right.
To talk to discuss with, to understand what she's going through, to speak about her problems. Because some girls are very lucky and have regular cycles which are coming bang on, no issues, they bleed for those X number of days, no heavy bleeding, no clots, nothing, and it's over. Okay. But there are some who may have symptoms on and off, who may get something that we call as PMS, which is premenstrual symptoms, as young as menarche, where they may have bloating, they may have irritability, they may have fatigue, they may have pain. Okay. They don't know why they're going through lower abdominal cramps. It's as if somebody's really twisting you inside. So these are things which need to be treated, or these are things which need to be spoken about, or give them the confidence that it's okay, we can do this, and it will help you out. So I feel the minute a young girl gets her cycle, she should have a gynec she can speak to. So most of the time, the gynec is always going to be a familial gynec, right? The one who the mother has gone to, aunt has gone to, grandmother has gone to, which is great because they know the family. It's fun for us also as doctors to talk to these young girls, explain to them what things are. And yes, so regular, not regular, is it normal, not normal, is very individualized. How much is the flow? Are they using 5 pads a day? Are they using 2 pads a day? Things change.
Right. And talking about periods, is it true that some girls, they don't even get periods?
True.
And in what cases and why?
So not getting periods is a term called amenorrhea. Okay, that means no cycle. Now, amenorrhea means no cycle. That doesn't mean that she has never got her cycle. It could mean that there are a few percentage of girls which get maybe one cycle and then they never get it. Okay. Or girls who have never got a cycle. right? Like I told you, till the age of 15, 14, 16. When we get involved, there are a lot of things that we check, a hormonal profile, all other characteristics and stuff, things on those grounds. And after checking all that, we realize that there are these some girls who will not get periods on their own,
Okay.
where we need to be involved to put them on certain medication and then bring on a cycle for the rest of their life. Okay. uh, does it exist? Yes. There are some who come to us with no cycle, and when we check them we realize, oh, they haven't got a cycle because of a condition where their hymen doesn't have an opening, so the period
Okay.
flow cannot flow out, so it keeps collecting inside. They come to us with different symptoms. Then we realize that there are some who come to us and we realize that, oh, maybe she's unfortunately not born with a uterus.
Right.
These certain changes, right? Is it very common? No.
No, right.
No, it's not very common. But does it exist? Yes.
And I know that you have expertise in,
I do.
treating these patients.
I do.
So I want to understand what are the exact, how do you treat them?
So there are different modalities, very frankly, Tushar, with which we, help these young girls and their families to go through this whole course. But these things can only be picked up if the family is aware of the situation and does bring them to a medical professional well in time. There is medical modalities to treat, there are surgical modalities to treat. Girls with a little bit of hormonal imbalance are helped by giving medical hormones with a lot of checking which goes at the background. Girls who do not have a hymen perforation, we have to treat them surgically. Okay. Girls who are born without a uterus, that's a completely different way of managing them. There are different syndromes that we are talking about. We're talking about anomalies where the uterus is not well formed.
Okay.
How we manage those patients, very frankly, Tushar, will take up a whole one day of me talking about it, but it deals with a lot of us dealing with the family as a whole, explaining to them how we can take this forward, because having a atrophic or a small uterus or not having one is going to affect them socially in the future.
Right.
So how do we manage these girls? How do we help them? Because some of them may have the ovaries, which is the hormone producing organ. So they're not different. You can never see them and say, "Arey, isko uterus nahi hai yaar." How will you tell them that? It's like a woman whose hysterectomy has been done. Hysterectomy is removal of the uterus for ABC reasons. You cannot look at her and say, "Ki acha, iska hysterectomy hua hai." So you will never be able to tell, but they require tremendous psychological help also,
Right.
including the family, because they need to be as supportive of that young girl. So, yeah.
And we were discussing about pads, but these days we also have the tampons and cups, right? So what is the right way? What are the right items to use? I don't know how to frame it, but
That's fine. So, what are the products that we have in the market today? Okay, so you have the pads, which have always been there. You have something called as menstrual cups. You have tampons, which have also been there for a long time. You have, the period panties. Period panties which are disposable, not disposable.
Okay.
Right. Now, what are all these things? These are all products which a girl or a woman can use during her periods. Right. Now, when we get our periods, that's basically blood flowing out of our system, which needs to be collected. Right. You just can't allow it to keep flowing. So pads and tampons was what was being used in the before, as still being used actually. Pads is like a cotton covering for your panty,
Okay.
which soaks the blood, okay, which is what we see in maximum ads. And you dispose it off as and when it gets full, or for hygienic reasons over 4 to 6 hours. Tampons is a smaller version but gets inserted into your vagina and soaks it up there. It's nothing on your panty. You're not putting anything in your panty. Okay. A menstrual cup is something, again, tampons need to be disposed, right? Tampons are something because they are inserted inside. Some women and girls may forget that they have inserted something inside because they're not getting a flow, and forget to remove it and throw, which is a very scary thing, right? Now, coming to something like an insertion is a menstrual cup. Okay, menstrual cup is basically, as you say it, a menstrual cup. It's cup form, it's in a cup shape, very easy to insert, comes in different sizes, um, from extra small to large, can be used by virgins, in the sense
Okay.
can be used by young girls, where you have to help them and teach them what it is to how you can insert a cup. Now the difference is it cannot be thrown, right? Cannot means it's not meant to be thrown in every use. You insert it, the blood gets collected in that cup format. You release it when you are in the washroom. So you empty the cup in the washroom, you wash it and you reuse it. But it needs to be sterilized
Okay.
every time, uh, on a daily basis. Now that's a menstrual cup. Menstrual cup came into being mainly for environmental reasons, because pads and tampons are not getting disintegrated for years on end, right? And so that's how menstrual cups enter the market. Then you have something called as a period panty. What is a period panty? It's basically an underwear which already has an inbuilt lining or a pad. Disposable period panty is similar to a diaper, which you use, it gets full, you throw it, you wear a new one. A period panty which is not disposable is something which you use and you wash and you use a new one. Okay, so which product is the best product? Whichever suits you is the best product for you. Whatever you're comfortable using is the best product for you. You're not comfortable using pads and you're very comfortable with tampons and cups. As long as you know how to use which product, how to sterilize that product, how to maintain hygiene with that product is good for you. Okay. Again, another thing that parents should agree and get knowledge upon, because their kids already have the knowledge.
Okay.
So they should be freely able to discuss, you know what, I don't want to use a pad, I want to use a tampon, or I want to use a cup.
With that, I have something for you. Like, one day, like I've just met this person.
Huh.
Okay, so this topic was discussed, and I
Okay.
just asked, like, and that guy was like around like 20,
Okay.
21.
Huh.
So I was like, you have girlfriend? Like, yes. Then okay. So tell me one thing. Your girlfriend is vocal about her periods to you, right? How
Super.
your mother reacts,
हाँ.
right? So she is like कि नहीं मेरी मतलब of course mom है मतलब अभी पता चल जाता है but she is not that vocal about it.
True.
वो rest कर लेती है वगैरह
हाँ.
वगैरह. And then this. So I asked him कि how many times you got pads for your mom or any of these products?
हाँ.
तो like कि never. And
Correct.
your girlfriend? बोलते, yeah, I do at times when she
Needs
asks
it.
for.
हाँ.
Like then, like I was just wondering and thinking, कि, like
Where's the gap?
Where's the gap? Like there are two things, na. One
Right.
is your like mom is not getting help because she is not vocal,
Right.
right?
Right.
And I think she should understand her son is now capable of handling his girlfriend and helping her in such situations. So of
So
course,
he can help her too.
yeah.
So you know what the thing is, that the good part is that the young generation is now vocal about things like periods.
Right.
Okay, it is a normal thing and it has been normalized, which is the best part. So it's not a hidden fact, like how I don't know if you remember, but pehle ke zamane mein or very recently also, chemists give pads in brown paper bags or black plastic bags.
में कुछ नहीं
हाँ,
रहेगा तो pack.
right? And this is my personal thing, that when I used to go get pads for myself and they used to cover it, I said, क्यों है? All girls get it, मुझे हाथ में दे दो. And it used to be very
disrespectful in a way.
Yeah, they used to be like, क्या है? Like, she's mad. But I've always carried pads when I go to buy my own.
No, I'll tell
in
you,
my
in
hand.
those medicals, na,
Huh.
if guy goes and he buys condom, they will be very proud. Oh,
But a pad no, na?
yeah.
Exactly. But today's generation, like you said, that boy you met is normalizing this whole thing, which is fabulous. Unfortunately, the parents are yet from a generation where talking about periods to their sons is not considered normal.
No.
It's not that it's considered a taboo either, but it's considered, how can you discuss it?
Yeah.
It's my thing. Why should my son know about it or go through it or blah, blah, blah? And but what these parents need to understand is that, exactly like you said, that son is capable of managing it, of understanding it. So give him that option, give him that leeway, let him feel that he's doing something for his
Right.
mom if she needs it. Like a very frank thing, I'm going to put this across, that having a podcast on my first period or periods with a male podcaster is what I love.
Wow.
Right? Because you're speaking about it, you're open about it, and that is exactly where we want to head. That is exactly where we want to go. So it's amazing. So for all these young boys and girls out there, I would say that show this podcast to your parents. Let them know that you're capable of handling them as well as you're capable of handling your partner.
Thank you for sharing across,
Thank you.
and I'm sure a lot of us will be like really happy to get all these notes,
I hope so.
and sharing them with the friends and families.
I hope so.
But before we end, I really want to ask a few myths that you think that people should
Related to periods?
Yes.
Okay. So there are a lot of myths related to the cycle, right? Okay, let me take simple ones. Okay, do not exercise when you're on your period. There's no reason why you shouldn't exercise. If the girl is not comfortable, if she's in a lot of pain, if she has a lot of flow, she herself will not exercise. But is exercising going to worsen my cycle? Not at all.
Okay.
Okay. PMS does not exist. It very much exists. Okay. Don't downplay a girl having premenstrual symptoms, which is PMS. She can have bloating, she can have irritability, she can have frustration, she can have anger, she can have cravings of having sugar, carbs. Very normal. At the same time, just because she's having those symptoms, don't keep her away कि अरे ये तो period पे है.
Yeah, don't label it.
Yeah, don't label it, because she may have got those symptoms triggered by something else coincidentally on the cycle. So you need to understand what she's going through. But does PMS exist? Yes. There is something called as PMDD which exists, which is premenstrual dysphoric disorder. What is that? Which people are not really aware of. Is basically PMS symptoms, but with a much stronger severity.
Okay.
With the severity enough to debilitate life, daily work routine at that point of time. Does it need to be addressed? Yes. So does it exist? Yes. You cannot have, but this is not for young girls when they've got their periods, like school going girls at 12, 13. But in general, a period myth, you cannot have period sex. You can. You're comfortable with it, your partner is comfortable with it, go ahead. There is nothing that is going to harm her health or anything. No. Little myths which are related to maybe Indian culture to a certain extent, that you cannot enter the kitchen. You should not enter the kitchen. If you touch preserved foods like spices or pickles, they are going to get spoiled.
Right.
Because you are emitting a smell or you're emitting some gas which apparently spoils the food. No. Other myths like not getting your periods regularly, that means you 100% have a hormonal imbalance. No. It can be a lot of other issues which we can deal with.
Having 21-day cycle is an achievement.
No, it's no achievement. Exactly. Your cycle should be regular. Yes. If it's not regular, it's a problem. Maybe not. So don't label anything. Don't feel that this is normal and correct for A, so it has to be the same for B. No, A and B are two different individuals. They're going to have two different things. You yourself are going to have a different period format in your lifetime. You're not going to follow the same format every month and month on month. So does that change? Yeah, it changes.
Yes. Thank you so much. I mean, I
Thank
was
you,
really
Tushar.
happy that you shared a lot of information with us.
Thank you.
And yeah, happy Women's Day.
Happy Women's Day to you too.
Thanks. Hi Anuradha.
Hi, Tushar.
Welcome back. And one question for you. How are you feeling mentally right now?
I'm feeling ecstatic. I'm feeling great today.
Yeah, glad to know. And I have one interesting topic to discuss with you is my first mental breakdown
Okay.
or meltdown where people, are not able to identify, accept. तो मुझे आज उसके बारे में बात करना है.
This is a very interesting topic, Tushar, and I think it is very relevant to the current scenarios that we are in, because a lot of people do listen to these words like mental breakdown, emotional breakdown, या फिर burnout. ये सारी चीज़ें सुनते हैं, but they don't understand where to get the right information from. Instead of that, they go to Google Baba, and then they start typing, and they get hundreds of information, and उसमें से एक दो पकड़ के they start relating it to them. So let us see through our conversation if we can educate our, audience a bit today.
Yes, surely. The first thing, since it's Women's Day, any specific difference about the meltdown in women?
So if we talk about women, yes, because women are considered to be multitaskers, right? And then they are considered to be, aajkal to male of the house is also, a woman, because she is expected to do everything and anything in their life, to support the family, to support the, professional profession that they are in,
Right.
and at the same time handle the kids and handle all the pressures together. So, in these scenarios, any one thing can definitely trigger and then take them to a state or make them feel that I'm not able to handle everything now.
Right.
So, that is something that we can definitely acknowledge. For example, I had a housewife, okay, who she was going through her menopause, and very energetic, very active, socially very active, has a great personal life. Actually, she says, I have no complaints, but I don't understand why I'm feeling low. And then I just feel like crying. And then I do not feel good about myself or anything that is around me. So, when we talk about these things, there might be the reasons like um, her association, her relationships at home, or it might be that the expectations that she has with herself or the family having from her, she's not able to meet those expectations. So that is when it slowly leads to a space wherein she is now exhausted,
Mm-hmm.
overstressed, at the same time feel like everything is out of my control. So we can define it as a meltdown in her life
Yes.
as a woman.
So, as we are discussing about a woman, so I think it all starts from their childhood. I think breakdown क्या है, एक चॉकलेट नहीं मिलने पे भी breakdown हो जाता है, right? So coming back to the understanding level, जब हम develop करते हैं to that point, maybe I would say a teenager, how would that person would identify कि उसका ये breakdown है?
So, तुषार, it is a very big myth that जो आज किसी का meltdown हुआ है तो बचपन से ही होता आ रहा है.
Okay.
It is not related to childhood in any way. I will not say 100%, but not everything that you're experiencing today is not related to your childhood, first of all. So, how does a teenager, okay, we need to understand the system, how teenager works. So, when we say that emotions, meltdown, उनका prefrontal cortex जो है, this part of the brain, which is part of the brain which is, which helps in rational thinking, like जैसे हम लोग normal language में बोलते हैं practically सोचना, okay, which helps in rational thinking, is developing, still developing, but their limbic system, जो हम लोग बोलते हैं, which associates or which helps in emotional regulation, right? So that is hyperactive.
Okay.
So they experience stress, they experience pressure, they experience sadness, anger, everything. They can experience everything, but do not know how to regulate it. So at that point of time, they are experiencing everything at the highest of amounts, but उसको पता नहीं है करना क्या है. What do I do about these emotions? So that is where, the meltdown word comes in.
Okay. And what are the factors, to feel that breakdown or meltdown? And as a teenager or someone who, is good, like how that person can identify कि हाँ मेरे साथ ये हो रहा है. because a lot of them are not even accepting. It could be like, I'm just feeling low. That's it.
Right. So when it comes to the teenagers, again, the adolescents, um, there is different ways that they understand the information that they are getting. So first of all, if we talk about the physical symptoms, I'll give an example. So there's this one girl, let us name her Bhavya, okay? So she
Okay.
had come to me and then she said, Ma'am, I'm not feeling very good. I'm feeling as if I'm feeling it's very heavy near my chest. And, I feel like crying. I've become very sensitive, which I was never that sensitive earlier. So I'm really not understanding, and then I really want to come out of it. And my exams are nearing now, so it's all the more important for me not to be in this state. So the background of Bhavya was she's an excellent student, very good in her sports and other activities, has very good friend circle.
Okay.
Okay, so she being a very good student, there was a lot of parental pressure that you need to achieve, you need to get to these grades, and then this is what you can do, matlab aankhon ka tara and all. The teachers also see her as one of the best students of their school who can get good accolades as well to the school, because
Okay.
ये अगर आ जाती है, she's in a 12th standard, if she gets school first या ऐसा कुछ आ गया, so the name of the school also, they will get lot of recognition. And third, the expectation from herself that I have to perform, otherwise it is, then what, there is no ifs and buts for her. Like my performance has become her identity. Now the performance becomes identity, she started taking in lot of pressure, not understanding what is happening around, why is this happening. Slowly she shifted into social media because she just wanted to avoid that pressure, because obviously she's not getting to understand it. So once she got onto the social media, there is something called as new word that we start using, that is called as highlight reels.
Okay.
Okay, highlight reel effect. So highlight reel effect is whenever we, these teenagers open the social media, they see that everyone and around they know, or the people that they are seeing, their life is so perfect, but they don't understand that there is a lot of difference between the real life and the curated real life. But she started associating with it and then taken a lot of pressure that people are like, they're achieving this, they're achieving that, I'm not able to do anything right now. That again has put in a lot of pressure, and emotionally she started experiencing a lot of irritation and frustration. So that is slowly has led her to having this feeling of, I'm not able to do anything, I'm not good enough. So it is very important for the teenagers to understand what is happening right now, because it is not something that is going to be there for a very long time. They know what is happening, but they just doesn't know how to handle that situation. That is the stage of teenagers.
Then how can we help, or how parents can help?
So as parents, we need to understand that this overloading of information is something that is disturbing our kids. That is, you know, at that point of time, therapy is not the one that is going to help, or counseling. They just need some guidance. They need help in understanding their emotions, acknowledging them, and at the same time giving that space. So just think about it कि for a student, जैसे भव्या का एग्जाम्पल लेते हैं, if she is not able to score good marks, वो आती है मार्क्स के साथ, that is very disastrous for her. वो आती है पेरेंट्स के सामने, and then parents are like, how can you get such low marks, and then तुम इतना अच्छा कर सकती हो, maybe because of that you did not perform, because of that you did. So they are giving a lot of information to her, and at that point of time that is not what she requires. As a parent, you need to be there and then react in a way, and then make them calm first. The child who is coming to the parent has to feel calm, quiet and settled. Just a small example, अगर बच्चों को भागते हुए हम लोग देखते हैं, as soon as they fall down, वो पहले आपके अगर पेरेंट फिगर वहाँ पे रहते तो उनके तरफ देखते हैं कि how should I express this, how do I process this emotion now. As in as we say, though हम लोग के अंदर डर लगा रहता है कि भाई कुछ तो हुआ है, but we say everything is fine, ठीक है ठीक है ठीक है, and बच्चा also starts feeling ठीक है ठीक है ठीक है, right? So that is the same thing that we need to use with teenagers. As a parent, you need to understand what is bothering them. Instead of exaggerating the situation in front of them, try to make them feel that situation is there, it is okay, we shall handle it together,
Yes.
and give them that space to do it.
And just now you mentioned about not every teenager, मतलब हर टीनेजर या फिर कोई किसी को भी हर एक को ज़रूरत नहीं होती है काउंसलिंग का, right? Then what are the cases that or what are the situations that they should be considering this counseling as a part of their therapy?
Okay. So, Tushar, whenever there is any sexual abuse, okay, emotional abuse, then phobia, certain sort of disorder like anxiety disorder or any other disorder, suicidal ideation. So, these are the 5 common things out of many. These are the 5 common things that we can identify that if these things are something that you are struggling with, then definitely you would need therapy. At the same time, when I say you do not need counseling, does not mean you don't talk to anyone.
Okay.
So what happens is when we say you do not need counseling, you just need guidance. For example, if you are talking, if think about a teenager who is 15, 16 years, talking to a friend of the same age, right? How much knowledge will that friend have? As much as this kid is having.
Right.
So there is no solution for the problem that they are fighting in there. They will not be able to find anything there. So if they are just discussing the problem, they are still in the problem, existing in the problem, and then just going by exchanging that मेरे साथ भी ऐसे ही होता है, तुम्हारे साथ भी ऐसे ही हो रहा है. So it's normal, right? And the second thing, when they tend to talk to other people, it might be think that they're not giving any guidance in helping them with the emotional regulation, but they're just giving their opinion about the child, which again is not helping the kid. So when we say that you do not need counseling, you need guidance from right experts who can actually help you in emotionally regulating. But at the same time, if the 5 things that I've mentioned, if any of these is right now you're struggling with, then you will need therapy from an expert again.
Okay. So of course they can't seek guidance from the same age group, but then tell me how a teenager can help another teenager to understand this better.
That's a very good question, Tushar. Because in that age group, generally you see the bonding happens with friends, and in this age group, they would want to be
Right.
with their friends and get support from them. So, if at all a teenager is seeing another child through any emotional breakdown, right, at that point of time, just staying with them, being with them, listening to them are the 3 things that can help the kid a lot.
Okay.
At that point of time, not sharing your experiences with them, because then you are validating everything that is happening, and they start feeling, oh, this is so real, this is literally happening to me. Second is giving them some space and then giving some comfort, safe comfort at that point of time, maybe some water, you are offering them something to eat. Okay, so those are the small things that you can do to make the child comfortable, make the teenager comfortable. And the third thing is, if they're able to name or talk about what exactly they are feeling at that point of time, the pressure that they're feeling inside, venting out happens. What are you feeling right now? So I'm feeling this, I'm feeling stressed, I'm feeling frustrated, I'm too much irritated right now. So these are the things again will mellow down the teenager who's actually going through that. So these are the few things that can make the teenager comfortable. At the same time, suggesting, maybe identifying key, who is the next comfortable person that the teenager is to, and taking consent of the teenager. Would you like to talk to that person or any expert about this?
Right.
So subtly pushing in and then saying that you need help. So in that way, a teenager can help the other teenager, and it works like wonders.
Wow. And again, then this particular teenager, let's say that person decides to approach now her parent, then what? Because it's very difficult at that age to express that, because you the kind of culture we have right now, parents working, or you know, the less time they have, or less, I won't say everyone, but at times it happens that there is some disconnection or this type of situation. I should not be discussing with my parent, they will be judgmental, the way that
True.
Bhavya ka example you have given, right? तो फिर ये situation में what is the like ideal way, or maybe what is the comfortable way a teenager can approach their parent कि मेरे साथ ये हो रहा है?
Okay. So in that case, see, they need to identify out of the two parents, which is a parent that they're most comfortable with.
Okay.
Okay. And then tell them exactly what they're going through. There are many a times that the teenagers do not feel my parents can help me.
Right, because that is the, it's not out of anything, but
No.
it's about like नहीं मेरा नहीं समझेंगे.
So that's my problem and then I need to solve it because that is the age जहाँ पे वो सोचते हैं वो बहुत बड़े हो चुके हैं, wherein they can take their own decisions, but still, as I said, they're still in that developmental stage जहाँ पे fully formed rational thinking है उनका. And when parents come in and then they say, they're very rational, right? They want to say everything कि ऐसे करो वैसे करो ऐसे
मैं
मत
वही
करो,
बता रहा हूँ नहीं
right?
नहीं 2 दिन तू एक काम कर, रेस्ट कर ले, ठीक हो जाएगा.
हाँ. So at that point of time, they need to identify one parent and then tell them, I need help. I need to talk to someone. That is also one of the ways that they can actually sort it out. They can seek guidance in understanding what is happening in their life, what exactly is triggering this emotional turmoil in them.
Okay.
Yeah, that is one of the ways that they can do.
And you think while approaching a psychologist, they should be always with their parent, or at least for the first approach?
So for the first approach, as you know, it is known, all the psychologists, okay, when we do counseling, we do say that we will be talking to the kid, and if they are, you know, adults, then we say we will not be sharing anything with you until unless we have the consent of the person.
Okay.
But it depends on the age group. If we are talking about teenagers, yes, we do say that, you know, there are two instances wherein we'll be sharing all the information with your parents with your consent, is when you're trying to harm yourself or harm someone else.
Oh.
Right? These are the
But
two.
what if like a situation where a teenager or that young girl or boy, maybe in that sense, doesn't want to, you know, not comfortable sharing that information with the parent?
So we ask them, how do we subtly put it to your parents? How do we, because it is not the
because why
child
I'm
who needs to
asking,
change.
maybe it मतलब बोलते हैं ना एक नॉनसेंस जैसा क्वेश्चन लगेगा, बट स्टिल कभी कभी लगता है ना नहीं ये आई एम नॉट कंफर्टेबल विद माई पेरेंट्स, देन इन दैट सिचुएशन इट इज वेरी डिफिकल्ट फॉर देम कि दो आई एम कंसल्टिंग, देर इज़ अ फियर ना कि अगर मैं मेरे पेरेंट के साथ डॉक्टर के पास जाऊंगा या साइकोलॉजिस्ट के पास जा रहा हूँ या कोई प्रोफेशनल के पास जा रहा हूँ, वो तो मेरे पेरेंट्स को सब बता देंगे. This is the ideology that they have.
Yeah. So they come with a lot of stigma and lot of fear, and then at the same time they come with this thing कि 1-2 sessions बात करके देखते हैं हो क्या रहा है. So they don't open up in the first 2 sessions first
Right.
of all. First 2 sessions में it's difficult that they share anything because they really want to see how the psychologist is working. And most of the psychologists, they do maintain this confidentiality, and then we say these are the things that you have to discuss with your parents because it's not about you. Agar suppose there are few things that have to be changed in the home environment, the parents are supposed to be involved in it or subtly have to be told that this is the way it has to be managed. So it is like a system that we are working with, and in India definitely, you know, that is something कि आप therapy बोलते हो या फिर I need counselling बोलते हो, immediately it goes तुम पागल हो गए हो क्या. Okay, but it's not about pagal hona. It is all about how you sort out whatever is going on in your mind in the most constructive way so that it is not hampering your daily life. The same thing applies for the teenager. So a teenager I think, and then she said, ma'am, I'm not very comfortable with my father. I said, okay, fine, what's happening? He said, मैं कुछ भी करती हूँ, he only shouts and then he explains, and I'm not very comfortable with that. I said, okay. Then she said, he always says कि मैं कुछ उल्टा बोलती हूँ उनको, बोलते हैं पापा हूँ मुझे कैसे बोल सकते हैं, I'm your parent, you're not supposed to say anything. But he doesn't understand if he's a parent, but वो जो feel कर रहे हैं, वो जो experience करते हैं, I also experience the same, right? Who will explain it to him? So subtly we had to tell the father that this is not the right way of communicating. There are many ways of communicating. And getting into a healthy relationship with your kids, at times maybe the parents also need therapy. And luckily now a lot of parents are seeking counseling just to understand how to navigate healthily
Right.
with their teenagers.
Right.
So it's two-way that we need to work on.
Yes, and coming back to the relationship, ये teenagers parents के साथ तो है, but they also have relationship with their partner, right? Then the breakups, then heartbreaks and everything. So, I mean, I am curious to know from you कि ये situation वो लोग handle कैसे कर लेते हैं?
So first of all, let us start accepting that अपना academic system में ना specifically emotions को लेके या फिर how to process your emotions, how to acknowledge your emotions, ऐसा कोई पढ़ाई नहीं हुआ है ना.
They just introduce कि these are the type of emotions that you can experience.
Right. So that is what happens. It's like अपने को they have given the machine to us and then the manual is not given. It's like that.
Yeah.
And then you're having the machine in front of you, don't know how to use it. कुछ भी दबा रहे हो, कुछ भी गड़बड़ हो रहा है उसमें. And you're looking for a manual. Our brain is just like that. And if we have to use it, a manual चाहिए. अब manual तो किसी के पास होता नहीं है. That is where we help in people in understanding, okay भाई emotions होते हैं. These are the different emotions that we experience. By naming them, by processing them, how do we do it? अभी breakup का ही ले लो. At that point of time when we are not equipped enough to handle that situation, why do you think हर कोई गाना सुनना नहीं तो they get into, there are different stages wherein they go through breakdown, right? Physical symptoms भी आ जाते हैं, psychologically they become very low, रोते रहते हैं, depressed हो जाते हैं, बहुत सारी चीज़ें होती हैं. At that point of time they need guidance, they don't need counseling, they need guidance. Situation आ चुका है, you have experienced it, how do you come out of it?
Right.
And social media glorifies mental health issues.
Yes.
Okay, but not everything is your mental health issue. It is situational as well.
Yes.
आज है कल नहीं है. It's just like any other season कि भाई summer है, winter है, spring है, वैसे ही your situations also keep changing. तो आज जो हो रहा है, the good news for any teenager, for anyone is, आज कोई situation में हो, आज कुछ हो रहा है, you're feeling traumatic, doesn't mean it is there for a lifetime. You will come out of it if you are equipped enough. But just like that manual use karna, you really want to use that manual to equip yourself or not is something that you need to ask yourself.
But adding on to your point, like I have seen there are a lot of institutes and academies. They have this special team of psychologists. They are actually helping a lot of children because sometimes it is very difficult for them because a lot of parents are working. They are not able to give enough time because of certain commitments that they have. So this team is actually helping them, and I'm sure like maybe down the line, 5 years, 10 years, it will be very easy for all the children also to express their emotions or maybe what they feel.
No, absolutely, because it is not only the intellect, right? Emotional intelligence is something that we need to equip every kid with. Because if you're empowering your mind, then you transform your life, is what I feel.
Yes.
So instead of bottling it up, speak up.
Thank you so much, Anuradha. I mean, it was really great speaking to you and such a great discussion that we had. And
I also
I'm
had a
sure
great
that this will be helpful for all the teenagers plus college going kids and the parents as well. And thank you so much. Happy Women's Day. But before that, any last message that you want to give it to all the women who are listening to you?
So just be yourself. Be yourself.
Express yourself.
Express yourself. Acknowledge what is going on in your life. And that definitely will bring in all the joy and happiness that you want in your life. All the very best and happy Women's Day to everyone.
Happy Women's Day.
Thank you.